he sustained a very, very serious lower leg injury back in 2015, which the Manchester United doctor told me, and Luke has since confirmed it publicly, that they thought it was limb threatening. It was that bad because of the underlying soft tissue damage. And I went up and visited Luke and his parents, and he was back training within a year using that.
Welcome to the Radical Health Rebel podcast. I'm your host, Lee Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. In this week's episode of the Radical Health Rebel podcast, entitled Reduce Pain and Increase Sports Performance Using Microcurrent Therapy, I spoke with Ian Thirkell about microcurrent technology and how it can be used to help reduce pain and repair damaged tissues in the body, as well as other benefits which have been experienced anecdotally. I'm not one for gadgets when it comes to health. However, after being introduced to the Arc4Health device by Tina Pears in episode 59 of the podcast, I was intrigued and wanted to find out more. So I reached out to Ian to ask him to come on the show to discuss it, and I wasn't disappointed with our discussion. Ian Thirkell, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
No, it's my pleasure, Lee.
Yeah, it's great to have you on. So, Ian, to kick things off, could you share with the audience perhaps your history, a little bit about your time in the Metropolitan Police, and also work as a personal protection officer for Princess Anne, and how you were introduced to microcurrent therapy and how that led you to produce the ArcEquine and the Arc4Health devices?
Okay. Well, I'm a farmer's boy from Kent, and as a 19-year-old joined the Met Police. I was promoted to sergeant after 5 years' service. And while a sergeant, and probably in my early to mid-20s, I was selected with 7 others from the whole of the Met to be trained by both the Met and by the military with regard to car driving, firearms, shooting, and also bodyguarding techniques. And I and we, as an 8, then became a squad. And basically, if ever you saw a royal going from A to B in a car, then we would be in the car immediately behind it. Really, as a result of the attempted kidnap on Princess Anne in the Mall earlier. And so that is our function. But also what we used to do is when we arrived at the function, we would leave the police car, unmarked police car, by the royal car being looked after by uniformed officers. And we would form a 3-man protection team around the royal, together with their own personal protection officer. And because I am a country boy and the other 7 were all townies, and because I was in charge of the diary, so that helped. Whenever there was a trick outside of London, then I would do it. And it usually involved a horse. So it was racing or polo or eventing. And so I got to know and be known by the Prince of Wales, the King, and Princess Anne. And when a vacancy occurred at Gatcombe, I was the natural one to go down there as her personal protection officer. So I worked with her for a number of years, based at Gatcombe, passed my promotion exam, promoted to inspector and returned to uniform duties, and then was posted to Bromley in the first instance, and then latterly to Orpington. Mm-hmm. And whilst I was at Orpington, there is an area in Orpington which has got a high density of the traveller community, which caused some problems. And so at the request of my boss, I selected a team and went down there to work specifically amongst the traveller community, which was very, very interesting. And then retired in 1997 after 30 years service. And became a very happy house husband to my two young children. And this enabled my wife to realize her dream of going to university. Went to Canterbury, studied radiography, got a first-class honours degree and a distinction in her master's. And one of her senior lecturers said she'd make a very good PhD student. Was she interested? And she had the real learning bug by then, so obviously jumped at the opportunity. And he gave her two subjects to look at. One of those was hyperbaric oxygen, and the other one was microcurrent technology. So she came home very excited and told me all about this. And so probably as a cynical, skeptical ex-policeman, I said to her, what the heck is microcurrent technology? And the way she explained it to me is the way I always explain it to others. And that is that every cell within the body communicates with every other cell by means of a sequence of minute electrical currents. These control everything that goes into and out of every cell, and therefore the proper functioning of the body. And that if there's any damage, disease, or trauma to a group of cells, then like any conventional electrical circuit with a fault, things don't work or they don't work properly. So the objective is to determine the currents that do particular things in the body, reintroduce them from an external source, thus mimicking the body's own natural electrical circuitry, kick-starting and accelerating many metabolic processes. Well, I can't repeat on air how I replied to my wife, because I thought that was nothing short of witchcraft, and was very, very quick to tell her so as well. But I kept an open mind and I researched widely, and I especially read two books that she brought home from the university, written by an orthopedic surgeon and researcher called Robert O. Becker. And these books were called The Body Electric and Cross Currents. So I read these books, and I was totally intrigued with this technology. And I think it's probably true to say that I have devoted the last 22 years of my life to exploring the boundaries of the clinical application of this technology. And I have seen some quite incredible things happen with this technology. So that's how it all started, really. Yeah. Now, my journey has followed parallel paths, those of horses and humans. And what works in one group always works in the other group, always. Now, after a number of years of research and anecdotal use, we actually developed the ArcEquine delivery system. And that became very, very popular, especially among the 3D eventing community, and then to the wider equine community as well. And in 2015, there was a catalyst which caused me to think seriously about actually then developing a unit for human use. So we started that process in 2015. We commissioned a professor to help us through that regulatory minefield, and we were eventually granted regulatory approval in 2016 for the use of our unit, which we call the ARC, and it is now a CE certificated Class 2A medical device, accepted as being safe and effective for use for humans, for pain, all aspects of pain, and for tissue repair, any tissue.
Interesting. Just looking at your history. So you say you started on a farm.
Yeah.
Did you have horses on the farm?
Well, not riding horses, that's for sure. We had, I'm now getting quite aged. So we're talking about immediately post-war in the 50s, early 50s. And certainly on our farm, we still had two shire horses. So definitely not riding horses. They were definitely working horses on the farm at that stage.
Yeah. So you had an experience of horses growing up. In the police force, you have horses. You then worked for the royal family, who are very much linked to horses in many different ways.
Yeah. And
then you worked in Orpington, you were saying they had a big travellers community, which also tend to have horses. Well, they certainly used to. I'm not sure about now, but they certainly used to have horses. So you've almost had a horse connection your entire life of some sort or another.
Yeah, I have actually on reflection, but never as a rider. Never as a rider.
Mm. Yeah, interesting. One question that springs to mind before we get into the more technical kind of detail: why are both devices, both the equine and the human, why are they called ARC? Where does that come from?
That just comes from my head, to be quite honest. While we were deliberating over names, I was tossing a few things around in my mind, and one of those was ARC, ARC, because arc of electricity, and the other one was ARC, ARK, which is the vehicle of deliverance, which I think this technology is and could be. And tossing that about, and then I decided on ARC, ARC. So that's how it, very innocuous way it came about.
Okay. So you've spoken a little bit about how microcurrent therapy works. Can you, I mean, again, obviously not everyone in the audience is, they're into electronics or they're electricians or whatever, but can you maybe explain in more detail how the electric body, if you like, works, and how providing it with a microcurrent helps with the healing and the reduction of pain?
Well, as I say, when there's damage, disease, or trauma to the body, then the electrical potential at that site changes because it's being disrupted. And so what we do is we reintroduce the currents to the body via the arc. And what it does in simplistic terms, which is the way I understand it, it actually kickstarts the body to restore normal activity to the body.
So because I'm just thinking from a muscular point of view. So if you've got, I don't know if you know what a trigger point is in a muscle, it's normally a point where you've got excessive activation, if you like. So excessive electrical input going into a particular part of a muscle. So I'm just wondering if it works whether there's not enough electrical impulse or there's too much electrical impulse.
Yeah, what we found, and we've now used this on over 20,000 people, is that it restores balance. So if there's too much of something, then it reduces it. And if there's too little of something, it increases it. So it restores the balance.
Yeah. Yeah. And the other thing, again, I know from, speaking to you before, and I know, a member of my family has used one for, I'm not sure how long it's been now, maybe 5 or 6 months, I think it might be, that you don't necessarily place it over the area of the pain. Can you explain that?
No, that's not necessary at all. We flew in the face of convention, really, because throughout my research, what I found was there are other microcurrent devices, and this technology has been known about for well over 100 years. So there have been, and there are other microcurrent devices, and many of them still actually, they either deliver the currents through clips to the earlobes, because the thought there is that the vagus nerve plays a really big part in how this technology works. So that's one theory. And the other one is that the positive and the negative electrodes need to be local to the area where there is a problem. And certainly when I first started with a really basic prototype, we had 2 positive electrodes, 2 negative electrodes. We used to put 2 positives below the point of the problem and the other 2 above it. So we follow that earlier convention of putting it local, and it worked. But then I had an increasing number of people that were saying to me, "Yeah, look, I'm using it for my knee, for instance, and yet I'm getting a sensation in my shoulder," as an example. And I had to think about this long and hard for a long time. And then I realized or remembered that I'd read somewhere that this technology works systemically at cellular level. So every time that the people have come back to me with that comment since, that they've got a sensation, not unpleasant, not painful, just a sensation, I always say to them, have you ever had trauma of any description where you're now feeling that sensation? And the answer has always been yes. And what that shows to me is this technology working systemically. So there is something unresolved in the shoulder, which may be the fact that there's scar tissue there, and the body is actually working on that area as well, because we have seen that pre-existing scar tissue is replaced by original tissue. We've seen that on humans a number of times. So it works systemically at cellular level, and therefore it is irrelevant where you enter the currents to the body. And the easiest places from a practical point of view to do that is either on the upper arm or on the leg, either just above the ankle, which is where most people wear it, or if people with very slim ankles, they can wear it immediately below the knee, so that the calf prevents the strap holding the arc from slipping down, or immediately above the knee. But it really doesn't matter where you enter the currents, provided the two electrodes are touching the skin.
Yeah, and that's because, as you said, that's because it works at the systemic level.
Yes, absolutely.
Gotcha. So you mentioned right at the beginning that you've been, I can't remember the word you used, but it's basically been passed as a medical intervention. Can you talk a little bit about how it's been scientifically proven? Can you talk about the process perhaps you went through and what the results were?
What, of the device itself?
Yes.
Yeah, I mean, from a regulatory point of view, what you have to prove is efficacy, the fact that it works. And certainly when we went through this process, the professor I spoke to you about earlier said, look, you have seen it work for a number of different clinical applications. But if we go to the regulators and make application for all of these, they will ask some serious questions. So what he advised in the first instance, in his words, go for the two low-hanging fruit, the ones for which there is already the most scientific evidence. And that was pain and tissue repair. And there are thousands of published papers relating to microcurrent. Just Google it and they all come up. So there is a wealth of published paper documentary evidence that this technology works. So that was the first thing that we had to prove, and that proved to be no problem. And the other one was safety. And that was a bigger story. And in fact, we've had to go through no end of electrical safety checks to prove that not only the device itself is safe, but also the fact that the strap that the arc sits in, which attaches to the leg or the arm, everything that touches the body, we had to prove was compatible. And that was a very, very lengthy process. But we passed.
Yeah. So with regards to proving efficacy, did you use already existing scientific data, or did you go through a process with the ARC device itself?
No, we went for pain and for tissue repair. We went for the existing scientific evidence. Yeah.
Right.
But certainly it's always been in my mind. I mean, as I say, I've said several times already that I've seen this work in a no end of different clinical applications. And those other applications, we will only go to the regulators once we've proven efficacy in randomized controlled trials.
Yeah. So it's approved for pain reduction, tissue regeneration. What else have you seen it used for that's been helpful? Michelle, a 44-year-old competitive master swimmer, came to see me due to severe pain in her left shoulder. The shoulder pain was greatly affecting her ability to swim, but she was training through the pain. Michelle had an arthroscopic subacromial decompression surgery, which only temporarily improved the pain, which led her surgeon to suggest that she retires from swimming. Michelle was ranked in the top 2 in her age group in the UK, and her goal was to win the 50 metres butterfly in the European Championships in 3 months' time and the World Championships the following year. Following a thorough assessment, Michelle's initial programs focused on improving her posture and stability, especially around her core and shoulder, as well as a number of nutrition and lifestyle factors, including a fungal cleanse. Michelle stuck to the plan pretty religiously, and 3 months after first coming to see me, Michelle won gold in the 50 metres butterfly in Stockholm at the European Championships in a British record time. And she also went on to win the UK Championships later that year. Not too bad for someone who was advised by her orthopaedic surgeon to stop swimming. So if you have a shoulder injury that's holding you back and you'd like to achieve a great result like Michelle, go to www.bodycheck.co.uk, that's bodychek.co.uk to request your consultation. Now, back to the podcast.
Well, one that's hitting the headlines at the moment, not the newspaper headlines, but in the community, if you like, is that three occupational health workers from a local general hospital at the end of 2020, who were all suffering from the effects of long COVID, decided to trial the units with huge success. And this eventually came to the attention of a journalist called Alice Smiley, who at that stage was bedridden with chronic fatigue as a result of long COVID. And without our knowledge, she borrowed a unit from one of her friends and used it and was up and about within a week. She then became very interested in the story, obviously, and then looked for a doctor who was an expert in long COVID. And she found a doctor called Dr. Tina Piers.
Yeah, who's a friend of our show.
Oh, really? Oh, of course. Yeah, I remember now.
Yeah.
Well, probably she's told you her story, but I mean, just very briefly.
No, tell it in full. It's fine.
Oh, okay. Well, Tina herself is a sufferer of MCAS, which is mast cell activation syndrome. So she trialed it on herself and was astonished when she didn't have to check all of the ingredients on the menu to make sure that it wasn't going to affect her. She was able to just go out and eat without a problem. She then trialed it on a number of her patients with long COVID, all with good results. And she then collaborated with Alice Smiley. And as a result of that, Alice Smiley penned a 2-page article in the Mail on Sunday in July 2022. And I mean, the world went crazy as far as we were concerned. I mean, so many people are suffering the effects of long COVID, different symptoms, that it became very, very popular. And we've done some research as a result of questionnaires to some of these users, and the major conditions that they tell us have responded particularly well. And the main one is chronic fatigue. The second one is breathlessness at rest. And then it follows with taste and smell problems as well. And so, I mean, that came to us out of the blue. It's not something that we promoted. I hadn't even thought about long COVID, to be quite honest, but that's the way things seem to be going. So it came from private individuals trying it themselves and publicity as a result of that. But you asked the other, well, they fall into 3 major categories, really. From my experience and from my observations and from feedback from customers, it seems to work very effectively on hormonal imbalances, for immune and autoimmune deficiencies, but also for the full range of psychological traumas, from anxiety right through to depression and post-traumatic stress disorder. And indeed, there are microcurrent devices in America that have FDA approval for anxiety, depression, insomnia, etc.
Gotcha. Yeah, so there's quite a few things that you've already experienced that the ARC devices can help with.
Yeah, quite a few.
So I imagine there's a lot of people listening to this episode, and we still haven't kind of described what the Arc device is, kind of what it looks like, etc. Can you just explain a bit more about there's different devices, right? If you could explain like the equine and the human one.
Okay, they are in fact one and the same pieces of kit. They're just branded for different audiences. The ArcEquine has got some additional features which make it more dust and damp resistant, not waterproof but resistant. Whereas we haven't bothered to do that on the human version. They both sit very easily in the hand. They're about 3 inches long by 1.25 inches wide. They only have 4 LEDs, small LED lights on the top edge, and they serve certain functions. And one of those is that they indicate what program you're on, because there are 4 programs delivered by both of these devices. So they act as a program indicator. They also act as an on and an off function. The lights. No, they indicate what program you're on. They also have a function when you're when you first switch the unit on, in that the more lights showing green when you first switch it on, the more battery power you've got left. And of course, the more you use it, the less and less lights come on. And also when you're charging it, the reverse happens, so that the more charge it takes on, the more lights go green. And as soon as you've got 4 green lights, you know it's fully charged. And a full charge takes about 4 hours, and a fully charged unit enables delivery for between 30 and 35 working hours. So that's the LEDs at the top of the unit. And immediately below that are 2 buttons, just 2 buttons. The left-hand button is the on and the off button, and also acts as a change program button. And then on the right, there's the play button. So just a push of that, and the currents are delivered.
So there are 4 different programs, you say?
Yes, there are. Yep.
And how are they different?
Well, the Arc delivers 2 different sequences of electrical currents. The first one kickstarts and accelerates regenerative repair. And the second one was originally designed to get rid of swelling, bruising, and inflammation very fast, which it does. It's that one that is used for pain, and it's that one that we know works for this other range of clinical applications as well, all of which seem to have chronic inflammation as an element. So I think its ability to reduce and eliminate chronic inflammation, I think, is key to a lot of these positive applications. And certainly in the Arc4Health, programs 1 and 2 are that second one, the pain-related, the rebalance, if you like, program. So they're both the same current of electricity, but they're delivered in slightly different ways. And we find that some people respond better to program 1 than they do to 2, and some respond better to program 2 than they do to 1. And the other current, the one that kickstarts and accelerates regenerative repair, that is within programs 3 and 4. And again, the same as 1 and 2, 3 and 4 are delivered in slightly different ways. And again, 3 seems to be more effective in some, and 4 seems to be more effective in others. And I have no idea why. So what we do when we recommend a protocol, we always get them in the first instance do a combination. So if anybody's in chronic pain, then we'll get them to do a combination of program 1 and 2. And if it's a tissue repair, we'll start them off on program 1, because to enable the tissue repair, we first got to get rid of the trauma. We got to get rid of the swelling, bruising, inflammation, and pain before, which sets the ground, if you like, to enable the healing to actually do its job.
Yeah, interesting. As you were speaking, I was just thinking as well that one of the conditions I help a lot of people with is acne. And acne is an inflammatory condition.
Yeah.
And I was just thinking, wow, that could be quite interesting to look into that. I don't know if you've looked into acne or any other skin issues, whether it's been able to help people with those.
Yes, it has. Yeah.
Oh, wow.
In a number of different skin conditions. Yeah. I actually don't want to be too specific, if you don't mind, Lee, because I don't want to raise people's expectations. But all I can say is anecdotally and reported back to us that there are certain skin conditions that have improved.
Interesting. That makes complete sense to me. If it's helping with inflammation, a lot of skin conditions are inflammatory. That makes complete sense.
Yeah. Yeah.
So, if people are using the ARC devices, like how long do they need to use them for?
Well, all 4 of the programs are preset to deliver for 3 hours, and then the unit just switches off. And what I can say is that over these 20,000 people, that 95% of users experience a tangible improvement within 6 weeks of use, within 6 weeks of daily use. But the imponderables, there are 2 imponderables. One of those is how soon it will be before an individual starts to respond. And the second one is once the response has started, how quick the progress will be, which is why we always give an initial 6-week protocol. And thereafter, I mean, what we recommend is that whichever one of, say for pain, the program they found the best for them, 1 or 2, then to carry on with that.
Yeah.
But the thing also with this technology is that you cannot misuse it and you cannot overuse it. And we get tales, we get stories and feedback of people that use it 15 hours a day. And we also get reports from people. I mean, I might go back to somebody 6 months after I've first spoken to them and said, "How's your pain?" And they said, "What pain?" And I said, "Oh, do you still top up with the ARC every now and again?" "Oh no, I use it daily." I said, "Well, why do you use it daily? You don't need to." And they said, "I don't want that pain coming back, so I'm happy to use it every day." It's very inconspicuous and very easy to wear. So it's just human psychology, I suppose, that they don't want this pain to return. It can't do them any harm, so there's no reason why not to use it.
Yeah. But generally, 3 hours a day is enough, you would say?
Yeah. So that's our recommendation. 3 hours a day for 6 weeks, then reassess. Yeah.
So it'd be quite easy for most people, wouldn't it? They might be at work all day, they come home, they stick that on and they take it off before they go to bed. There's their 3 hours easy.
Yeah. Or a lot of people stick it on when they go to bed.
Right. Yeah. Yeah.
So yeah, any time that's suitable to their situation, really.
Yeah.
But it's okay for us guys because generally speaking, we wear long trousers of some description, and most of us probably wear socks. So worn on the lower leg immediately above the ankle with the socks rolled up over it, which is very easy to do, and nobody would know it was there.
Yeah. So you mentioned earlier that there are a number of microcurrent devices on the market. What's different about the Arc4Health device over the other devices?
I think the major one is its simplicity and its size. I mean, there are many ARC devices where you actually have to go to a clinician to be plugged in, if you like, at an appointment. Then you go away and you've got nothing to turn to. So as has been miniaturized and simplified for home use, and that's its major benefit.
Yeah. So and it's portable as well, right? Rather than
entirely portable. Yeah. Yeah.
So you don't have to go somewhere and be plugged into the wall, kind of thing. You just take it wherever you go.
Yeah, absolutely. And many people take theirs on holiday. I always recommend that if they do that, they put it in their suitcase in the hold, because they don't want that to come up on the X-ray machine. Probably ask all sorts of questions. So just put it in the hold and it'll be perfectly okay. Yeah.
Gotcha. So who would you say can use the ARC device and who perhaps, if any, shouldn't?
Okay, there are certain exceptions within our user manual that we advise, and that is the usual ones, if you like. That's pregnant women and people with cancer and people with pacemakers. But strangely enough, quite recently, we've seen an article in a newspaper saying that they are producing an implantable microcurrent device for certain heart conditions, which quite surprised us. But at the moment, in our exclusions, those are the main exclusions, and they are a straight lift actually from the TENS exclusions as well. Something that we followed when we went for our regulatory approval, despite the fact that the currents delivered by the TENS are 1,000 times stronger than the ones delivered by the R, and work to a completely different principle. But it was easy, it was expedient for us to do a straight lift from the TENS exclusions when we went for our regulatory approval. So that's what we have to advise.
Yeah. So, I mean, it might well be. I mean, it seems like it might be the case that actually, I mean, you mentioned pacemakers, but if someone doesn't have a pacemaker, but they do have a heart issue, there's no studies to actually say that it might be detrimental, is there? Even though you would advise, not to, but I'm guessing there isn't any evidence that they actually do harm the micro.
Yes. I mean, that's the situation with those exclusions. There is no evidence to say that they will do harm, but there is no evidence to say that they will do good.
Yeah. And I guess you can't really do studies on pregnant women either, can you, really?
But it'd be tricky, wouldn't it? Yeah. They would probably balk at having an electrical device whilst their baby is growing. Yeah, absolutely.
Yeah. Although, again, you never know. It might actually be a really good thing, but until you got that evidence, you can't say that, can you?
No, absolutely not.
So you mentioned the TENS device. Can you explain what the TENS device is for people that perhaps don't know what that is?
Yeah, the TENS device is, as I understand it, a device which is used where there is acute pain, and it's quite often associated with females in labour, actually, and where it masks the pain. It's a diversionary tactic to relieve the pain. It doesn't actually address the root cause of the pain. It's just a diversionary tactic, whereas the ARC actually addresses the root cause of the pain, which is quite often chronic inflammation.
Yeah. So TENS is transcutaneous electrical nerve stimulation, isn't it? And it's often used by a lot of healthcare providers, like physiotherapists, for instance. I know sometimes use TENS devices.
Okay. Yeah. I mean, it's quite a well-known treatment modality. Absolutely. Yeah. And it's very, very good, as I understand, for a short-term effect. Absolutely. Yeah.
So I mean, someone goes to physiotherapist, they've injured their knee, and they put a TENS device on their knee. They're going to leave the clinic, and their knee's going to feel better, right? It's going to feel better. Obviously, it's not been cured, but it'll feel better.
Yeah. But for how long? That's the problem.
Yeah, because it's not dealt with the root cause of the problem.
Sure. Yeah.
So we've mentioned horses. Can you talk a little bit about the experiences you've seen of people using the ArcEquine device for horses? As a semi-professional rugby player, Billy had suffered from recurring injuries for the previous 3 years before coming to see me. He'd been suffering from a sharp pain, swelling and tightness in the top of his right leg. It was especially bad when drop kicking and punting. He tried sports massage and stretching, which had brought about some short-term relief. However, when playing rugby, the pain always returned. He also suffered from sharp pain in both groins, which restricted his movements. The pain was worsened by kicking and changing direction at speed, and as a fly half, kicking and changing direction was an essential part of Billy's game. Acupuncture and sports massage had some benefit, but still felt tight afterwards. All the above injuries meant that he could only play 3 matches in a row before he had to take 3 to 4 weeks out to recover. This was very frustrating for Billy. Billy came to see me to help condition him during the off-season so he would be ready for the upcoming season, even though he wasn't very confident that anyone could help him get rid of these injuries. I had a very limited time to help Billy, but over the 8-week off-season, after thorough assessments, I gave Billy a corrective exercise program for the first 4 weeks and a strength and power program for the second 4 weeks prior to his pre-season training. Over halfway through the season, Billy reported that he is yet to get injured. In fact, he was kicking better and further than ever. He was running quicker, cutting off 1 foot better, and bursting through tackles, and that he'd never felt so sharp, quick, and strong. If you're in pain and it's preventing you from doing what you love to do, and you'd like to achieve great results like Billy, just go to www.bodycheck.co.uk. That's bodycheck.co.uk to request your consultation. Now, back to the podcast.
Yeah, absolutely. Probably the best illustration is one of the first horses that we actually dealt with, and that horse had just come second in the Grand National in 2007, and it finished on 3 legs because the superficial digital flexor tendon, the main tendon down its front leg, had totally ruptured. So its fetlock was on the ground, and the vets put the screens round the horse on the track, ready to euthanize it, when they were stopped by the trainer, who said, "What are you doing?" And they said, "Peter, this horse will never bear weight again. You must allow us to put it down." And he said, "No, you're not." So he travelled the horse back that day to Pembrokeshire. And I saw the trainer 4 days later with the first working prototype of the Arc. And he used it every single day. And that horse was being ridden to exercise 3 months later. It raced in March 2008. And it raced in the Grand National in 2008, 1 year on. So that's the extreme end of things that we see. But we see horrendous injuries, wounds to horses. And one of those is it's not unusual for them to catch their shoulders on the metal catches on gates as they go through, and especially if they're kicking up a bit, and they just open up a wound on their shoulder. But the worst one I saw was a fence stake that had entered the horse by the shoulder and had followed along its rib cage by about 2 feet. And this was a big open wound, and that closed with no signs that it had ever had a wound. But with horses, and it's the same with humans, actually, it's the same with anybody using this technology. Quite a few horse people have now latched onto that, but probably because I've been dealing with them individually for longer. But what I always say to people, look, it's great for restoring your horse, but it's equally as good at prevention as it is at restoration, and it's equally as good at maintenance as well. So I always recommend that as soon as a horse is broken in, not as soon as it's broken down, use the Arc on it. You don't need to use it every day. You just need to give it a quick burst, say 6 weeks daily, and then just adopt a maintenance regime. And that will help to prevent a lot of the cumulative damage that affects tendons and ligaments, because tendons and ligament problems are not often a single event. They're cumulative. And it only takes sometimes a stumble in the yard for quite a catastrophic injury to present itself. So, as I say, equally as good at prevention and maintenance as it is at restoration. And certainly in horses, even when the horse is better from a fracture or whatever was wrong with it, we then recommend they go onto a maintenance regime. And that is to use it every 4th weekend for 2 days, any other similar regular routine to suit them, provided that the intervals are no more than 4 weeks. Because what happens with when you use this microcurrent technology, the benefits accumulate in the body. So, and there comes a time when you've actually got to the point where it's not doing any more good. So at that stage, you can stop using it on a daily basis. But because we are all, humans and horses, subjected to the stresses of life, what we say is that benefit will slowly be eroded. So take up a maintenance regime to account for that.
Yeah. So it's not only, show jumping horses and race horses, but it's, people that have got a horse in a stable and they just go and ride for fun.
The little girl with her pony, that's the one it's aimed at, to be quite honest. And that has always been my philosophy, that we must aim for the little girl with her pony as far as the operation of the device is concerned. Keep it as simple as we possibly can and keep the price as low as we can as well.
Yeah. What about other animals? Have you ever used it on other animals?
Yeah, it's been used very successfully on cows with a dairy farmer down in Wiltshire, and also on dogs. Quite a few people have used it on their dogs. But the difficulty with them is that obviously they come in all shapes and sizes, short-haired and long-haired and deep-chested. And so you have to use a little bit of initiative when putting them on a dog to account for their different sizes, really.
Yeah.
But yeah, any animals respond to this technology.
Yeah. So I would say a dog, it would strap around their torso, so to speak, rather than the leg.
Absolutely. Yeah, around their torso. Absolutely. Yeah.
Gotcha.
Yeah, and quite often what people do is that they put the device on the horse, on the dog's back, and then they hold it in place with a rack that's commonly used in by the equestrians, which is called vet rack. Don't wish to publicize them, but it works very, very well. Or a bandage of some description. Just holds it in place. And what we find happens with all animals is that people will say, "Oh, my dog won't put up with that. It'll have that off straight away." What we found time and again is that as soon as you actually put the device on and switch it on, they become very, very calm. Very calm.
Yeah. And I'd imagine that they'd be almost sad when you take it off as well, because they almost think, wow, I really like it when that's on. Yeah.
Yeah, but nobody's reported back about that yet, so I don't know.
Yeah. Do you have any other kind of stories of any animal really that would be quite good to share in terms of an animal started using the device and X happened?
Not with animals so much. Certainly other applications. I mean, for humans, we use it for both clinical and sporting applications. And it's been used by many of the members of a high-profile, high-achieving GB Olympic squad, many international and Premiership rugby players, and also by Luke Shaw, the footballer, Manchester United and England footballer. I don't know whether you recall, but he sustained a very, very serious lower leg injury back in 2015.
Yeah.
Which the Manchester United doctor told me, and Luke has since confirmed it publicly, that they thought it was limb-threatening. It was that bad because of the underlying soft tissue damage. And I went up and visited Luke and his parents, and he was back training within a year using that. But it's interesting, because we also do a lot of collaboration with Greenwich University.
Oh, I went there.
Oh, did you? Oh, right. Okay. Yeah, with the sports science faculty at Greenwich Uni. Yeah. And they've done a number of clinical trials for us. And two of them that spring to mind from a sporting application, which are also now published papers, are that they used it on a cohort of recreational runners at Greenwich. and they used it on a group of long-distance semi-professional athletes at the University of Madrid. And what they found was that prophylactic use, preventative use, had a profound effect on mitigating the effects of lactic acid and DOMS, delayed onset muscle soreness. And that's probably why, on hindsight, the Olympians, the Olympic team, had such good results when they all used it. But it's not only relevant to athletes of any description or any age, it's also relevant to anybody who participates in a physical activity, but not on a regular basis. I mean, when you go out and start your gardening first thing in the spring, if ever it's dry enough to get out in the garden, you'll end up with aches and pains. Well, using the ARC would actually mitigate those effects as well.
Yeah. I mean, I would say people that regularly lift weights often suffer from delayed onset muscle soreness.
Yeah.
I mean, I've got it right now, and I've been lifting weights for 40 years. So anyone lifts weights intensely is going to get DOMS. So there's definitely a potential application there for people that regularly lift weights.
Yeah, absolutely.
And that makes sense. If it reduces inflammation, then it will reduce DOMS. I mean, there was a supplement that was really big back in the 90s called beta hydroxy beta methyl butyrate, which is easy for me to say. Actually, it's actually big in the horse racing circles as well. That was because again, what it does is it helps to prevent delayed onset muscle soreness. It's kind of disappeared off the scene. I'm not sure exactly why, but it sounds like it's possibly a similar kind of mechanism in how that works.
Yeah,
that's really interesting.
Certainly, one of the researchers at Greenwich was himself an international middle and long distance runner in his youth, but still is very, very active and runs age group international races as well. And he used it at the same time, and he said, "Look, with this unit, you can train harder for longer and recover quicker." And his times at all distances that he ran increased quite significantly.
Interesting. That's very interesting. Yeah. So, as I mentioned previously, you did send a device to one of my family members who suffers from fibromyalgia, and I just want to read out. I sent her a message the other day and say, "Can you send me a message for me to read out based on your experience?" So she wrote, "At first I was wearing it all day, every day, but after a while, she said it started falling off and it made it uncomfortable, but it has made me feel so different. It's really difficult to explain, but I almost feel at peace, whereas previously I always felt in turmoil. I still have pain, but it's not as intense as it was, but I have been more able to do physical things that I probably shouldn't do because of my spine." So this person also has osteoporosis, so needs to be careful.
Oh, right. Okay.
But I'm hopeful that this is also helping my spine. I have recommended it to a lot of people, and a few of them have been in touch with Ian. And then she just finally says, the best way to describe it is that it somehow brought a new level of clarity. Yeah. So she's definitely sold on it. I mean, she would not stop using it now after the benefits that she feels. But, you know, for someone with fibromyalgia, to reduce the pain is quite a big thing, you know?
Yeah. I mean, fibromyalgia, I mean, it's a generic term, really. It's a catch-all term for a whole list of different symptoms. And I think to this day, they don't seem to know what causes it. And there's certainly nothing that they can do to help people as well. So to hear that, I mean, that brings goosebumps to me, to be quite honestly. I mean, that's why I do this job, to hear people come back and say things like that. It's fantastic.
Yeah. I mean, fibromyalgia, I think, is multi-causal.
Yes.
And I do think quite often medical establishment looks for one thing to cause an issue, but I think it's multiple things. And we do know some things that do cause, or at least contribute to fibromyalgia, such as breathing pattern disorders and things like that. But that's a whole nother podcast.
Yeah.
Before we wrap up, is there maybe another really good story you could tell about someone that's used the Arc device and kind of got a really good result from it?
Well, the trouble is that the good stories are anecdotal ones that are outside of pain and tissue repair, which I mean, I don't want to come into conflict with the regulators. That's the problem.
Okay.
That's the problem we're in. But what I would say is that if anybody is suffering from anything that involves chronic inflammation, then they should either give it a try or get in contact with us, and we'd gladly have a chat with them. No problem.
Yeah. Awesome. Great. Ian, this has been great having this conversation. It's something that really sparked my interest after speaking to Dr. Tina Pears on the podcast last year. So it's really great to get you on. What's next for you?
The next thing will be, we hope, in the near future, is to apply for FDA approval.
Right.
Because certainly in this country, we're getting a lot of traction now with integrative functional medical practitioners, and who are very happy to look beyond, what they're trained to do. Very happy to look beyond pharmacology as something to use, which is very heartening, and they're coming back with some very, very strong results. So FDA approval next, we hope, absolutely, but also expanding our ambassador base as well. Ambassadors are usually clinicians, but not necessarily, who have seen this work for themselves, or in a patient, or in themselves personally. In those circumstances, we're happy to accept them as ambassadors, and basically they refer their patients. So if they buy, the patient gets a discount.
Yeah, that's great.
And we think that's the way to go. I mean, we're not into adverts. I don't support adverts. I'm not altogether confident in the ethics behind some adverts. So I think that mouth to mouth, but person A telling person B is far more powerful and far more relevant than a bland advert. And that's the way we do things.
Yeah, definitely. It's interesting you mentioned the FDA, because I was going to ask you where the device is available.
Well, we've got regulatory approval throughout Europe.
Okay.
The British Isles and throughout Europe.
Yeah. Gotcha. And where can people find you online?
Yeah, go to our website, which is www.arcmicrotech.com. And then they can either go into the equine side or into the health side.
Gotcha. And are you on social media?
Yeah, funny enough, we've got a new company starting with us just on next Monday. So yes, we will be. I've not been involved with this. I've left this to others in the company, but I think it's the big four, they call it, the big four. So you will know better than I, Lee, what the big four are. Yeah,
it's probably Facebook, Instagram, Twitter, and TikTok, probably.
Absolutely. They are the four, actually. Yes. Yeah. So, yeah. We're not there at the moment, but we will be.
Okay. Well, whenever you're set up, I'll make sure I'll add those details to the show notes so that people have got those. That's brilliant. Thank you, Lee. It's very kind. No problem. Ian, thank you so much. I've really enjoyed this chat, and I'm really intrigued myself now because, I lift weights, I play tennis. Tennis can cause a lot of inflammation in the body. Yeah. That to me would be a potential market. I think would be great, actually, tennis players, especially those that are playing very regularly, because they're playing every day. They're breaking down tissue every day. Absolutely. So that would be great for those. Someone like the LTA would probably be a good contact for you. The trouble is making contact with those people, because
quite often when it doesn't happen so much now, but when I phone people up and they said, "Oh, you're a doctor?" So I said, "No, I'm not a doctor. No medical training at all. I was a policeman," and they just put the phone down. It doesn't happen that often now, but it did in the early days, as you can probably imagine. But
yeah, I did know the head of sports science for the Lawn Tennis Association, but everything changed structurally, so that person's not even. I don't even think the department's there anymore.
Right. Okay.
Which I think is a bit strange, but it's a strange organisation in some ways.
Yeah.
Yeah. So Ian, thank you so much. This has been really great, and hopefully some people listening to this are going to feel it's a good investment to make in their health to at least try out the ARC device for themselves.
Okay, fine. Thank you so much, Lee.
My pleasure. So that's all from Ian and me for this week. But don't forget, you can join me same time, same place next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.